So empty today. Well, okay. Hello, everyone, and thank you all for joining me this afternoon. I'm Mayor Paulette Guajardo, and I'm going to start the update this afternoon on COVID-19. I want to take a moment to acknowledge the major disaster that occurred last week. I know that residents across our city were greatly impacted by the extreme weather that we experienced. The city remains under a major disaster declaration declared by President Biden on February the 20th, and many of us are still recovering. We witnessed tremendous human suffering, and we continue to here in the city of Corpus Christi. We're working on that here as your representatives to help you through this next phase here of recovery. Through all this week's hardships, though, I did see hope in our residents. Through neighbors helping neighbors, families, strangers coming together to aid one another, I saw the best of our city. And I want to thank the residents of Corpus Christi from the bottom of my heart for working together as you did and pulling through the way we did together. Due to the major disaster we experienced, scheduled vaccine drives across the state were negatively impacted. So to make up for that disruption, your city county health district is ramping up vaccine distributions to serve the public this week. I believe it was starting yesterday. The city county health district distributed 10,000 vaccines, roughly. Today at the Richard Borchard Center or Fairgrounds, 5,000 more or less for first dose vaccines were administered. Our health district is doing an amazing job and vaccinating on average about 555 people per hour. And we're very grateful for that. We will also be hosting another vaccine clinic inside the city at the American Bank Center on Saturday, February 27th. Pre-registration for this clinic will open online, and full details on that clinic are forthcoming. Please keep an eye on the city's website at news.cctexas.com and your local news outlets, of course, for any updates. I will also share the information with constituents as soon as it is available. This week's vaccine allotments do not include second dose vaccine clinics. Second dose clinics will be scheduled at a later date, and individuals who are receiving their second dose do not need to register again. Rather, the second dose vaccine recipients will also receive the magic link via the reverse alert system, and you will need to click on the link and follow the directions. Text messages, emails, and phone calls are all provided will be provided to notify people of their second dose appointments. So second dose patrons who attempt to register again for a vaccine clinic could deprive someone of receiving their vaccine. So please do not attempt to go in and register again. The city has been distributing second doses for over 2 months now. So please keep in mind that the date of your second dose listed on your vaccine card from the City County Health District is not an appointment date. In fact, the cards from our City County Health Department read second dose on or after. If your second dose is on the horizon, please monitor the phone number you provided to the health district for a reverse alert notice to confirm that your second dose appointment has been made. Additionally, 2,000 of our seniors and homebound residents who've received their first vaccine through the Saving Our Seniors Homebound program are now ready for their second dose. So this week, our fire department started administering second doses and have already fully vaccinated 144 homebound individuals. So we're very proud of that, and we thank our fire department and our EMS and firefighters. The Saving Our Seniors program will continue with second doses this week, and we will focus on fully vaccinating that roughly 2,000 individuals who've already received their first dose and who are in the program. The city's keeping track of the number of vaccines distributed countywide at cctexas.com/vaccine registration. To date, The total number of vaccines administered in Nueces County is 74,322, with the City-County Health District accounting for 9,574 individuals completely vaccinated against the coronavirus. So your city team and I are working tirelessly to ensure that every individual who wants a vaccine gets one. I look forward to the day that our vaccinated numbers equal our population, and I know that that day is coming. Every day we continue to hear about advancements in vaccines. The new single-dose vaccine from Johnson & Johnson, that's on the horizon in a matter of possibly just some weeks. And we're seeking a decline in our daily rate of COVID-19 infections. So I remain very hopeful that better days are ahead of us. And so I ask everyone to just continue to practice safe measures, wear your mask, stay distanced, and let's all get through this. We'll continue to work hard to make sure everyone has their vaccines and that you're able to get them. But we appreciate the patience. But I can tell you this entire team on this side of it is working very hard for that to happen daily. So I'll go ahead and pause and have Gabby translate in Spanish, and then we'll hear from our county judge, or I'm sorry, who's county judge? Yes, Barbara Canales.
Primero quiero hablar sobre el desastre ocurrido la semana pasada debido al clima extremo, pero lo que me dio mucho gusto fue la solidaridad de nuestros residentes para ayudar a sus vecinos, familiares y amigos. La ciudad permanece bajo una declaración de desastre mayor declarada por el presidente el 20 de febrero. Debido al gran desastre que experimentamos, las campañas de vacunación programadas en todo el estado se vieron afectadas negativamente. Para compensar esa interrupción, el Distrito de Salud está aumentando la distribución de vacunas para servir al público esta semana. Habrá una clínica en el American Bank Center próximamente y también la preinscripción para esta clínica solo se abrirá en línea. Los detalles se darán a conocer posteriormente. Todos los detalles y todas las notificaciones y noticias de la ciudad se encuentran en el portal de la ciudad a la dirección news.cctejas.com. Tan solo el día de ayer se recibieron más vacunaciones para una segunda dosis. Las personas que van a recibir una segunda dosis no necesitan registrarse nuevamente. Los usuarios de la segunda dosis que intenten registrarse nuevamente en una clínica de vacunas para primera dosis podrían privar a otra persona de recibir esa primera dosis. Más de 2,000 residentes adultos mayores han recibido también su vacuna mediante el programa SOS, el cual está siendo administrado por los bomberos del Departamento de Bomberos de la ciudad. A la fecha de la segunda dosis, en la tarjeta de vacunación se encuentra una fecha de su segunda dosis, pero esa no es una fecha establecida, simplemente dice segunda dosis o después. Si su segunda dosis es pronto, usted va a recibir un mensaje mediante un aviso de alerta inversa para confirmar su cita. A la fecha, el número total de vacunas administradas en el condado de Nueces es de 74,322, mientras que 9,574 personas más ya recibieron ambas dosis. Pronto esperamos tener más vacunas, especialmente de la compañía Johnson & Johnson. Mientras tanto, les seguimos pidiendo que practique todas las medidas de salubridad en lo que continuamos estas clínicas de vacunación.
Okay, and I'd like to add an update to one of the statements I just made. So today we did receive 5,000 of the second doses for those who received their first dose on January the 26th. So if you received your first dose on January the 26th, you will be receiving a reverse alert later this afternoon with detailed information regarding your second dose, which came in today, and appointment information, obviously. Thank you.
Le quiero indicar que el día de hoy recibimos 5,000 vacunas para segunda dosis. Estas son para las personas que recibieron su vacuna el 26 de enero. Así que si usted recibió su vacuna el 26 de enero, va a recibir un mensaje mediante el sistema de alerta inversa en donde se le va a dar una fecha para recibir su vacunación de segunda dosis. Ahora el reporte de la juez Bárbara Canales.
Gracias, Gaby. Barbara Canales, Nueces County Judge. Well, this week we are coming out of the severe winter weather disaster, and we had an urgent need to get our COVID vaccination back on track. We called it Catch-Up Week. We lost an entire week due to weather. And between the pandemic and the winter storm disasters, I have to look really hard for silver linings. And there are silver linings, and probably best said in the words of Joe Kennedy, when the going gets tough, the tough get going. And city-county health is tough. And so we got going. And our silver lining for us is that we have had a chance to prove that we can get 2 weeks' worth of vaccine allocation delivered in 48 hours. It's a silver lining because of the more we prove we can deliver, the more we can get allocated by the state of Texas when more vaccine is available. And as the mayor alluded, there is no doubt that the news coming out of our national platforms is that more vaccine is headed our way. The great news is that, as was alluded to, FDA actually approved a third coronavirus vaccine from Johnson & Johnson, and its efficacy rate against severe disease is also incredibly high. More vaccine is coming. I heard it said in the news last night that over 20 million will be ready for distribution and or can be manufactured, and 4 million will be ready for distribution very quickly. Texas is sure to get its fair share. The Johnson & Johnson vaccine is a single-dose vaccine, very different than Moderna and Pfizer, which means it will be ideal for hard-to-reach populations. The homeless is an example of that hard-to-reach population, the homebound, and those with mobility or transportation issues are sure to benefit by this one-dose vaccine. We do not know yet when Nueces County will receive this vaccine, Johnson & Johnson. But what we do know is that our proven ability to deliver vaccines in volume sends a very powerful message to Austin and the vaccine allocation panel, and also to our federal partners. If you provide us more vaccine, the city of Corpus Christi and Nueces County Public Health Department can get it into our most vulnerable populations efficiently and effectively. We also know that more vaccines will be coming to Texas, as I said, through different federal programs. And these federal programs are in addition to what we just talked about with the Johnson & Johnson. This adds to our current state allocations. It doesn't take away. These, of course, are always referred to as some of these federal pharmacy programs. So whether it's Costco, we don't have a Costco, but whether it's Costco or Walmart or H-E-B, Walgreens or CVS, this federal pharmacy program is working to administer vaccines large scale. And of course, in the large scale application, there's regional and local pharmacies that will benefit, including those here in Nueces County. These additional federal vaccines is a net gain. And not taking from our state allocation, it's a net gain. And as we all know, every vaccine makes a difference. I also want to say that our ability to deliver vaccines in volume did not happen overnight. This team, I told you, this tough team, this city-county health tough team has done a great job bringing vaccines not only to our hub site inside the regional fairgrounds, but also inside Corpus Christi. And back in December, when we did those very first drive-through clinics and administered 500 shots, and then we did 500 shots again, in January, we ramped up to 2,000 shots, and then 4,000, and then 5,000. And like any new process, we needed to follow a time-tested path. Sometimes people refer to it this as crawl, walk, run. We're running now. We started with 500 vaccines, and then, as I said, we did it again, and then we moved to 2,000, then 4,000, and again, ultimately that 5,000 goal. And it takes working as a team to make sure this delivery is actually possible. Sometimes that team works all day long, whether it's at the fairgrounds or at other locations like the American Bank Center. And I mention this history in part to thank those involved, and in part to let you know that there is a lot of learning curves going on. I saw it firsthand yesterday. I actually witnessed speed. There's so many times that I wish I could just push those cars, let's go. Or be able to say, no, you're here too early, you're not in the right line. But what I saw yesterday was true efficiency. It felt different, it looked different, it timed different. Everything is getting faster and definitely more efficient. And so this mass vaccination that we've been working on since the pandemic really started is actually a process that began almost a year ago in its planning. And there's a saying in the military that no plan survives first contact with the enemy. And because I get so much inspiration because we're such a military town, I thought it much like Ike said, of course that's Eisenhower, he would say things like, plans are worthless, but planning is everything. And that's exactly how I feel about everything we're doing here. So the plans that got started with CCFD, maybe that initial plan that you see on paper is not that important, but all of the preparation makes that program so uber successful. So in the months prior to actually getting the vaccines, I just want you to know that all that planning combined with a lot of great adaptation, pivot, pivot, pivot. Anytime something's not going in the best interest, change it. And it got us to the point today where we can deliver these 5,000 vaccines, and we can do it day after day. And we're just going to get better, and we're going to repeat it at different places. And when we've learned that there are issues with those plans when they hit the real world and you're trying to scale up, basically, whether it's traffic flow or parking or restroom facilities, we need all hands on deck to help us basically make those adjustments and adapt. We planned this registration system, for instance, and honestly, it's really working so well. It's really been refined over time. And so now you get a block of time. And I want to say thank you to all the public who are really paying such close attention to the time we're asking you to get there and the time you actually get your vaccine. Yesterday, I was in court today, but yesterday it was really a 1-hour process. And that is a huge change from those early days where it was so painful to watch people have to wait for so long. We recognize the need to have a mix, article after article talking about the digital divide. So now we have a mix of registration options. And I think that we all agree that it's the best method that's available in this imperfect world that we're living in. So we've been able to bridge the digital divide and serve our community in an equitable manner. And we've held clinics at other locations, and we need to broaden those, cast the net wider. Today, I told my court in our opportunity to discuss our COVID-19 response that I bet very soon, in the next few months, perhaps those big vaccination hubs like we have at the fairgrounds won't even exist anymore because there'll be so much vaccine that's saturated in the marketplace, there won't be this mass rush to get vaccines in arms at one location. And while these hubs are always going to serve a great regional purpose, our goal is to make sure we have mass distribution where the people live. And so I would say that the exciting part is that we're starting to see mini clinics pop up. We'll be conducting one this week, in fact tomorrow, for teachers in Group 1A and 1B at Church Unlimited, and that's their Stone Oak campus on Highway 281. And we're doing outreach with our homebound seniors, and you're going to hear so much more about that tomorrow. And that is a true testament to the planning that went into effect so long ago. And all this planning and all this continued practice means improvement. It means that when more is available, we're going to get more to the people because we have a proven track record of what we can do and how we can deliver vaccines in quantity. And my friends, that day is coming very, very soon. But here it is today. And today, we're still operating with a restricted supply of vaccine. And this is a nationwide phenomenon. Although here in Nueces County, it sure didn't feel limited this week. It felt like we were inundated. But we know the reality is that there is a limited supply. And Johnson & Johnson is going to make a major difference. So, we still have this regional hub. We still have a hub inside the city. We still have great need. We still have all kinds of providers that are anxiously awaiting vaccine. And there's no doubt that the majority of our patrons are still coming from Nueces County, but we're serving such a regional demand. And the majority from Nueces County reside in Corpus Christi. So, Chief Kidd, who's kind of our idol in emergency management, time and time again says that the hubs prove that they can deliver in volume. Who can deliver in volume will get the vaccine allocation when more vaccines are available nationally. So tomorrow when the governor is here, I know the mayor will echo along with me how happy we are that we can report how much we can handle, how important it's been to allocate to those vulnerable populations. And the fact that we've been operating a drive-through clinic capable of 5,000 a day since January, quite frankly, is everything to brag about. In fact, not to be too braggadocious, but Austin, Texas, our state capital, just today announced their drive-through mega clinic. And again, we started ours in early January. So I'm grateful to City County Health for the planning and grateful for all those who are out there working this issue and making things run better every single time. Those are the heroes of your community. And many of the same people we need to conduct vaccinations, the nurses, officers, firefighters, EMS, operations support, guess what? They were working day in and day out last week to respond to that winter weather crisis that we're still, quite frankly, living the aftermath of. We've also had tremendous support from volunteers. I have to acknowledge Texas A&M University and Del Mar College. We had over 50 nursing students yesterday on premises. And look, there's so many other volunteers that come and register and are part. In fact, this wonderful, beautiful lady right here, she's vaccinating every single chance she gets. So I have to say, and by the way, those calls of can you come help are like literally 9 hours before we need to be there. So I want to close with a word about these second doses. You just heard the mayor say we have received second doses. The people are going to get them, are going to be notified, reverse alert. You've already heard that, but it doesn't hurt to say, please make sure you're following the rules about getting there timely. It makes all the difference. If you want to get in and out in 1 hour, follow that time block. It works. And make sure that you understand that if you haven't been reverse alerted, please be patient. You will be. There's no doubt that there has been a delay from last week, and we are playing catch up, but we're gonna finish everybody's second doses. And don't mix vaccines. Don't get panicked. Don't go get Moderna if you've gotten Pfizer. If you've gotten Pfizer, don't go get Moderna. Remember, you have 42 days after that first dose in order to get that second dose. Now, we try to get you right on time and on target, but just know that there's that cushion and that wiggle room. So, I want to thank you again for working, all of those who are working on vaccination programs, a success. In a strange way, everyone, we've only just begun. But the 3 W's are always still in action. And I talked to you about when the tough get going, the going get tough. Well, one of my favorite Christian spiritualists is Robert Schuller. And Robert Schuller has a great saying, and he says that tough times don't last, but tough people do. I have a feeling that everybody watching this is tough. I know firsthand that City County Health Department is incredibly tough. And we've all suffered this trauma together. It's been painful. It's been palatable to actually feel people's pain all last week. And so I want to say to you that if you need a little help, you have a great city, you have a great county, and we're here to help you. And again, we're here to make the tough times better because they won't last. The mayor said it best, brighter days are ahead. And we're going to outlast this terrible, terrible virus and disease. And so I ask all of you to pray for one another and to pray for this incredible team. And together, we will come out on the other side. Thank you.
Debido al clima severo, no pudimos administrar vacunas durante la semana pasada, pero esta semana vamos a intentar ponernos al día. Tenemos muy buenas noticias, ya que la FDA el día de hoy aprobó la vacuna Johnson & Johnson, por lo que esperamos pronto recibir más vacunas. La vacuna Johnson & Johnson es solamente de 1 dosis. Aún no sabemos cuándo podremos recibir esta vacuna. También esperamos recibir más vacunas por parte del gobierno federal, que podrán ser administradas mediante proveedores como H-E-B, así como Walgreens, CVS y otros proveedores. En diciembre llevamos a cabo la primera megaclínica móvil con 500 vacunas y cada vez hemos aumentado ese número. Con cada clínica hemos aprendido y mejorado el planeamiento de las clínicas. También hemos refinado el sistema de registro. Esperamos pronto recibir tantas vacunas que esas megaclínicas no sean necesarias, ya que la vacuna va a poder obtenerse en un sinnúmero de lugares. El día de mañana, cuando tengamos la visita del gobernador, la alcaldesa y yo vamos a estar felices de anunciar que podemos operar una clínica en donde administramos 5,000 dosis en un día. Estos esfuerzos son posibles gracias a los empleados de salud, así como a los voluntarios, como enfermeros, bomberos, paramédicos y ahora con voluntarios del Colegio Del Mar y de la Universidad Texas A&M. El día de mañana y el viernes vamos a administrar vacunas de segunda dosis. Las personas elegibles a estas van a recibir una notificación mediante el sistema de alerta inversa. Por favor, no vaya a obtener una segunda dosis en una clínica de primer dosis, ya que debe de esperar a que su cuerpo desarrolle anticuerpos. Además, no es recomendable mezclar las vacunas si son de dos farmacéuticas diferentes. Le puedo asegurar que la vacuna de segunda dosis la va a recibir a tiempo. También le quiero agradecer a todos sus esfuerzos, incluyendo a nuestra intérprete de señas, quien ha ayudado a vacunar en nuestras clínicas móviles.
Gracias, Gabby. One last thing I'd like to update everyone on that I apologize for leaving out. It is a very big event tomorrow. The reasoning as to why our governor is coming to Corpus Christi. And that reasoning is because of the program that he is very interested in asking questions about. He wants to see how exactly our firefighters are implementing the program, and the program I speak of is our Saving Our Seniors Homebound program. This is obviously something that Corpus Christi has taken lead on literally over the entire state of Texas. And so we're very, very proud, we're honored that Governor Abbott will be here just to look into and speak to us about this program that has been so successful. Although we wish that it could go faster, and we wish that we could double, the manpower and the vaccine power behind the program. At this time, we can't. However, the fact that we are touching this sector of our population, which is our most important, my city council and myself have the utmost priority for our most vulnerable, our seniors, our disabled, and those at home that cannot get in any line, short or long, short or long, it doesn't matter. So again, we welcome our governor tomorrow. We're honored, and we really, really are proud that we are the lead in the state of Texas to touch this vulnerable population. So thank you. Gabby, you can translate that, and then we'll hear from our health director, Annette Rodriguez. Thank you.
La razón por la cual el gobernador va a venir mañana es por el programa Salvando a Nuestros Adultos Mayores, o SOS. Este programa es un orgullo de nuestra ciudad y el gobernador quiere aprender más sobre cómo hemos administrado ese programa para los más vulnerables y quienes están confinados en sus hogares. La ciudad de Corpus Christi es líder en llevar a cabo este programa y esa es la razón principal por la que el gobernador va a visitar.
Good evening, Annette Rodriguez, Public Health Director. So I'm going to go ahead and start with the COVID-19 statistics. And so we have the bar graph over the last 2 weeks. And if you look at the far right side from February 11th, 2001 to February 17th, that 143 up to 73 cases per day equates to 524 individuals with COVID-19 last week. This week, from February 18th to today, it equates to 357 COVID cases this week, for a total of 881 cases in the last 2 weeks. Next slide. So our pie diagram basically shows 35,512 people that have recovered from COVID-19. We also have 1,223 active cases of people with COVID-19 currently in Nueces County, which has dropped. That number has dropped from over 2,000 to 1,000. 704 deaths for a total of 37,439 cases of COVID-19 since the beginning of March 2020. We also know that the United States has exceeded 500,000 deaths in the United States since they started having cases back in 2020. The next slide is basically the hospitalizations. The good news is that you're starting to see the dip. And so if you look at the far right side, 141 people 2 weeks ago were hospitalized with COVID-19. And as of today, 91 people with COVID-19 hospitalized today. So the number does continue to decline. We want to continue that. We hope that that's what continues to happen. Again, we're kind of worried because last week, because of the weather, our numbers did decrease, but we want to make sure that they continue to decrease. These are patients that have COVID-19, but they've needed intensive care, and so they've been transferred to the ICU. So you're also seeing it decline from 2 weeks ago at 52 cases to today, 37. And you see it kind of wobble, but it's kind of continuing to slant downward, which is a good sign. The total COVID-19 deaths exceeded the 700 number, so we're at 704. Today we did have a death, a male in his 80s with both diabetes and hypertension. Our condolences to the family that lost that person to COVID-19. And the last slide shows the deaths over the last 2 weeks. So if you look at last week, we had the weather, severe weather. We had 10 deaths last week, and this week, beginning February the 18th, we've had 20 deaths this week for a total of 30 deaths cumulative. So now I'm going to switch over to what's been going on at the health district, but I'm going to start with the slide that you see up, and that's the vsafe.cdc.gov. So anybody that has gone to one of our mega drive-thrus to get their COVID-19 vaccination, they should go to this site, the vsafe.cdc.gov, and sign up. You can sign up on your phone, and what it does is it prompts CDC to send you messages checking on your health. And so they check weekly, sometimes they check daily, depending on how you're doing. Sometimes they even pick up the phone and call you. They have representatives working to try to get as much statistics on the different vaccines as possible. It's a really good application to put on your phone, and it walks you through it. So if you're able to and you've had your vaccination, please visit this site. Thank you. Okay, so the mega vaccination drive-thrus are still ongoing. Last week, the weather made it, of course, impossible to host a drive-thru, nor were vaccines able to be delivered. This week, the state resumed shipping the COVID-19 vaccine. We received 10,000 first doses on Monday, therefore prompting the health district to resume our mega drive-thrus. Today, we were at Richard Borchert, and we pre-scheduled 5,000 recipients. If you were one of these recipients, you received a reverse alert notification, which had instructions on how to enter the drive-thru, the date, the location, and the time. These instructions are unique, and they help us make the drive-thru more efficient. We ask that those instructions are not shared, as they help keep the line moving much faster if you just keep it to yourself and not share it with neighbors, and then everybody tries to come through. If you are not on the reverse alert or our system and you show up, you will be asked to leave and register for a later date. Tomorrow and Friday, as the mayor said, we are set to administer a round of 5,000 second doses over those 2 days. And this will be at the Richard Borchert Fairgrounds. These are second doses for people that were vaccinated on January the 26th. These are your specific doses. So tomorrow and Friday as well, starting at 9 a.m. Regarding second doses, we received many questions. Some of these questions include, I'm scheduled to receive the second dose, but I have not been contacted regarding my appointment, and it's due today. What's going to happen? So I think a few people have mentioned, but basically CDC, the Department of State Health Services, have control of when second doses are allocated and shipped. As such, the health district does not receive vaccine shipping information weeks in advance. Instead, the health district receives notification, usually a day before the vaccine arrives. This week, there are individuals who qualify for their second dose, but we still have not received notification on when we will receive the second dose shipment. So these are the January 29th individuals. They will be due their second dose on Friday, but we have not received their 4,000 doses. So people are calling us, asking us, but that shipment has not arrived. So again, be patient, and we will notify you when they do. The good news is that for Moderna vaccine, you have 4 to 6 weeks after you receive your first dose, and for Pfizer, you have 3 to 6 weeks after receiving your first dose. These ranges have been approved by the vaccine manufacturer and show the same protection level. If you miss that window, you can still receive your second dose, and you do not need to start the series over. So if it's 7 weeks, you can still get your second dose and you're done. Next question. I received a reverse alert notification for my second dose, and my relative needs to get his or her first dose. Can I take him or her with me so that they can be vaccinated during the second dose drive-through? The short answer is no. The second dose vaccines are specifically for the people that receive their first dose vaccines 28 days before or somewhere thereabout. So no, you can't bring a relative with you and try to get them a first dose at a second dose clinic. Next question. Why can't you tell me when my appointment is a week in advance? The real reason is that we receive it and we try to put it in people's arms as quickly as possible. So we received 5,000 today. We're having clinic tomorrow as well as Friday. We don't want to wait a week to give you a vaccine that we know could save your life. Next question. I can't register with the health district when pre-registration is open. Why can't the health district have more registration events? We are one of 60 providers in Nueces County who are able to provide the vaccine. Although we have tried to make the drive-through as easy to come and go as possible, it is still difficult for certain individuals to be vaccinated through our mega drive-through system. What we recommend is to check out other places where it may be more practical for your needs. Our motto is to vaccinate with a sense of urgency. Whether you are the one being vaccinated or someone else is, the goal is that we are trying to achieve a 70% of the population to become vaccinated. If 70% or greater are vaccinated, we will get closer to the concept of herd immunity. Herd immunity means that the majority of the population is vaccinated or that they've already contracted the virus, and the likelihood of you or anyone else who has not been vaccinated coming in contact with a sick person drops significantly. If you have not been able to get vaccinated, you will have your chance. We also must consider the quantity of the vaccine. At this time, as the judge mentioned, the amount of vaccine available is still very limited. Once the production of the vaccine meets the demand, other phases will be open. Last question. My appointment was at 9, but I didn't make it. Can I go on a different date? Once your appointment has been set, we cannot hold a vaccine for you. This is only because the vaccines, once they are out of the refrigerator, they must be used. If they are not used within a certain amount of time, we must discard them as it is recommended by the manufacturer. And we don't discard, we actually put them in somebody else's arm. So far, I'm proud to say that the health district has not discarded a single vaccine. Every vaccine available has been administered. If you are not able to attend, please call and let us know. We cannot guarantee that you will be in the next drive-through since we don't know when the vaccines will be here for the next drive-through, but we will certainly do our best. Alternatively, re-register on another day that we have the phone bank open. If you get vaccinated somewhere else and you registered with us, call us so that we can release the vaccine and give it to someone else. And I too want to thank our volunteers, and I want to thank Mrs. Timberlake because she's been there vaccinating with all of us, and it's a lot of work, it's a lot of fun, but it's a community effort. So, thank you.
En las últimas 24 horas se han reportado 92 casos confirmados por el coronavirus. 881 casos se han reportado en la última semana. Más de 35,000 personas se han recuperado por completo, 91 personas continúan en el hospital, 37 están en la unidad de cuidados intensivos. El día de hoy se reporta un fallecimiento. A la fecha, los fallecimientos totalizan 704 personas. Los Estados Unidos han rebasado ya el 500,000 de personas fallecidas debido a complicaciones por el coronavirus. Si usted ha acudido a una de nuestras megaclínicas, se le pide accesar al portal vsafe.cdc.gov, en donde usted podrá recibir más información pertinente a su vacuna. Las clínicas móviles continúan en su curso. El clima de la semana pasada hizo imposible recibir vacunas en todo el estado. Ayer recibimos 10,000 primeras dosis, por lo que hoy llevamos a cabo una megaclínica. 5,000 personas recibieron la vacuna. Recuerde, las instrucciones que usted recibe son personales y se le pide no compartirlas para hacer así la clínica lo más eficiente posible. Hasta el día de hoy hemos administrado 32,000 vacunas de primera dosis y 10,000 vacunas de segunda dosis. Entre el día de mañana y el viernes se van a administrar otra ronda de 5,000 vacunas en Rowstown. Estas solamente van a ser para segundas dosis. Algunas de las preguntas que hacen los residentes son: estoy programado para recibir la segunda dosis, pero no me han contactado con respecto a mi cita. ¿Cuándo lo conseguiré? Los CDC y los servicios de salud del estado tienen control sobre cuándo se asignan y las envían a segundas dosis. El Distrito de Salud recibe una notificación unos días antes de que la vacuna llegue al Distrito de Salud. Este retraso en el flujo de información reduce nuestra capacidad de planificar con semanas de anticipación. Esta semana hay personas que califican para su segunda dosis, pero aún no hemos recibido notificación de la llegada de esas vacunas. La vacuna Moderna tiene de 4 a 6 semanas después de recibir su primera dosis y para Pfizer tiene de 3 a 5 semanas. Estos rangos han sido aprobados por el fabricante de la vacuna y muestran el mismo nivel de protección. Si pierde esa ventana, aún puede recibir su segunda dosis y no necesita repetir la serie. Otra pregunta es: recibí una notificación de alerta inversa para mi segunda dosis y mi familiar necesita recibir su primera dosis. ¿Puedo llevarlo conmigo para que pueda ser vacunado durante la clínica de segunda dosis? La respuesta es no. Las vacunas de segunda dosis ya están asignadas a una persona que ha recibido su primera dosis en el pasado. Cualquiera que esté en el vehículo y que no esté vacunado no podrá recibir una primera dosis de la vacuna durante una segunda dosis. Por favor, utilice la preinscripción. Otra pregunta es: ¿por qué no me pueden decir cuándo mi cita es con una semana de anticipación? El Distrito de Salud no tiene control de esa información, solo los Centros de Control de Enfermedades y el Departamento de Servicios de Salud del Estado. Otra pregunta es: ¿no puedo registrarme en el Distrito de Salud cuando la preinscripción está abierta? ¿Por qué el Distrito de Salud no puede tener más eventos de registro? Le recordamos que no somos el único proveedor de la vacuna. Existen 60 proveedores en el condado de Nueces. Les recomendamos consultar en otros lugares si el ir a una megaclínica no es para usted debido a las citas. Nuestro objetivo es vacunar al 70% de la población para así obtener el concepto de inmunidad colectiva y aminorar los casos positivos por el contagio. Otra pregunta es: mi cita era a las 9, pero no asistí. ¿Puedo ir a otra cita? Una vez que se haya programado su cita, no podremos reservarle una vacuna. Esto se debe únicamente a que las vacunas, una vez que están fuera del refrigerador, deben usarse. Si no se utilizan en un tiempo determinado, debemos desecharlas tal y como lo recomienda el fabricante. Afortunadamente, el Distrito de Salud no se ha descartado una sola vacuna. Si se vacunó en otro lugar y se registró con nosotros, llámenos para que podamos liberar esa vacuna y dársela a otra persona.
Thank you. Are there any questions? And the judge and the mayor are still here if you have questions.
Sure, I have a question for the judge.
Okay. Judge?
Yes, sir?
Thanks, Judge.
Yes.
Ron Hammond with Chris 6 News. What will the allotment of vaccinations be going forward for the city and the county, and who makes that decision?
Yeah, so we've been pretty steady with our allocations. We've been receiving about 5,000 first doses a week. We're constantly pressing for more. So what we distribute within the community really is up to what that allocation panel winds up giving. Let's take, for instance, what if we were to have 20,000 come our way? If that happened on a, Friday morning, we usually find out Thursday night. So by the time you can make some good decisions on Friday that it's coming in on Monday, most likely your health director and your local health authority would gather the troops and they would figure out how they could best disseminate that. So that's really the best answer, is that we wait every week patiently for that Thursday call. And after that Thursday call is when the work begins to figure out how best to utilize it. Now, it's really important that you recognize that we're just not monitoring at the county our vaccine allocation for our hub. We're monitoring it for Amistad, the federally qualified health center. We're monitoring it for Driscoll, for Christus, for HCA, for Coastal Bend Wellness, Men's and Women's Health Clinic, and about 50 others that I don't want to rattle off, but you get the idea. And so, for instance, one of the decisions that got made just yesterday is that there is an extra 1,000 doses of Moderna that Christus has. And because we have a relationship at the county with Christus and we can provide logistics, we're going to be able to run a vaccination clinic early next week in Port Aransas with those doses. So who made that decision? Well, the county with Christus Spawn. They're there. They are the tentacle for the state, right? But I do that in cooperation with City County Health and the local health authority, because we want to make sure, and I even called the regional health authority, because you really want to make sure that you're doing the best job that you can. And because the Port Aransas has zero, they don't have any providers inside that community, and there's such a distance there geographically, we thought that was a good decision. So that's an example of a decision that I get involved with directly. And then there's the big decisions which come for the hub, right? So the state of Texas has declared, I don't know, I think there's like maybe 59 hubs. Those are regional hubs. And there's a vaccine allocation panel. And that advisory board reports to Dr. Hellerstadt, and they make the decision on how many vaccines come to that hub. And then the local health authority, Dr. Ramesh Grajuni, along with Annette Rodriguez, your health director, they figure out what the best plan is. And we concur as a logistics support team, if that helps answer your question. Yeah.
Seeing no other questions, thank you very much. Thank you for being here with us, and we'll see you next Tuesday at our COVID-19 presser. Thank you.